Well, thank you, everybody, and welcome to this webinar looking at the state of childhood dementia and the report that was released that outlined the work that we've been doing here at Childhood Dementia Initiative. Before we begin, I'd like to recognise that the work of Childhood Dementia Initiative takes place across the lands of Australia's First Peoples and the traditional custodians. I acknowledge the continued connection and contribution to land, water and community, and pay my respects to elders past and present. And today I'm joining you from the lands of the Gadigal people. I'm Maack. I'm the CEO of the Childhood Dementia Initiative, and I'm also mum to two kids who have a form of childhood dementia. Their names are Isla and Jude. I'm also going to be joined today by the wonderful Nicole Jamieson, who I'll introduce you to shortly, who is a fierce advocate for childhood dementia and also a fellow mum. A little bit of housekeeping. If you have a question throughout the session, you can pop it in the Q&A box, which should be at the bottom of your screen, and we'll get to those at the end of the session. But today we're here to look at the state of childhood dementia and dive into some of the findings that were outlined in this report that we released in September 2024. Which really looks at the lived experiences of families, the challenges that are faced by healthcare professionals and some of the other infrastructural problems that are in place, but also what the pathway towards solutions might be. So before we go on, I would love to introduce you to Nicole. Nicole joins us from Perth today, and here she is with her beautiful son, Toby. Nicole, can you tell us a little bit about this boy and how special he is?
Hi, everyone. So my Toby is 10 years old and he is just a bundle of energy. He's a bit of a Peter Pan. He's sort of forever stuck in toddlerhood, which is just beautiful, but also hard work. Loves everything Christmas, as you can tell by that photo. I describe him as putting the fizz in our life. If you think of a carbonated drink and you shake it up, that's him. A lot of fun, and he's a wonderful kid with tons of charisma and wraps everybody around his little finger very quickly.
And I love that. I love that metaphor of the fizzy drink. I can just imagine that. And of course, beautiful Toby has a form of childhood dementia. What can you share with us around his diagnosis?
Mm-hmm. So we knew something wasn't right in the first year of life with delayed milestones. Tests came up which just showed global developmental delay. Genetics had our bloods for about 4 years before they called one day and they gave us the diagnosis of Cockayne syndrome. Cockayne syndrome occurs 1 to 2 per million. It's a DNA repair disorder. It's multisystemic. It's fatal and has a life expectancy of 12.4 years of age. It affects everything, like I said. It's multisystemic, so he's short in stature, deteriorating eyesight, hearing, he has tremors, mobility gets progressively worse, swallowing, breathing, you name it. It's a terrible, terrible thing.
It sounds dreadful and very similar in terms of presentation to a lot of the childhood dementia disorders, and I'm sure the experience, and you've already described the delayed diagnosis, is one that is also highly relevant to our community and some of the findings that were outlined in this report. So let's dive into the report, and I'm going to talk through the evidence and some of the things that were presented in it. And Nicole, it'd be really great if you were then able to bring some of these examples to life with how you've experienced them in caring for Toby. So first of all, the report. This report we launched at Federal Parliament House in Canberra, and the reason we decided to take it there was it's an important report with important messages, and we wanted to make sure that senior politicians and policymakers and people who are able to really drive change were hearing what we said and hearing the issues and the challenges that we outlined. We had about 20 family members travel from all around the country, from Cairns, and of course, Nicole, you came across from Perth, to contribute to the conversation and to help raise awareness. On the day, we were actually very fortunate to get in front of two very senior politicians, the Honourable Maack Butler, the Minister for Health and Aged Care, and you can see we also did have the opportunity to put the report and its findings in front of Prime Minister Albanese. So it was a big day, but a very important initiative for us to be driving in our nation's capital. I want to dive in and look at the report, but before I do, I just want to recap on childhood dementia and what we're talking about here. So 1 in every 2,900 babies are born with a condition that will lead to dementia in childhood. That's about as common as a far better known disorder, cystic fibrosis. Unfortunately, for the children who have these conditions, 50% will die by the age of 10 and 70% won't reach adulthood. These are conditions, collective, made up of more than 100 conditions that are all genetic in nature. And here in Australia, which is one of the high economic countries of the world, and it is similar in other countries that we've also looked at, there is a similar number of lives lost to childhood dementia as childhood cancer. But this isn't a problem that has been previously looked at as a collective or with that, consistent and common voice. The Childhood Dementia Initiative is all about changing that. We're driving systemic change for the collective group of disorders that cause dementia in childhood. And our vision is for sustainable global health solutions for children with dementia. And of course, we're doing a lot of our work here in Australia, but we're doing it in a way that is applicable to other countries and can be scaled globally. And the work that we're doing crosses across research, care, and advocacy. And I think it's really important to note all three of those are important. We can't just focus on research. We can't just focus on care or policy and advocacy. We need to do all three of those things in order to get the intersection across systems and across for the solutions that we need. And ultimately, what we're wanting to see is treatments and cures for children with dementia, equitable, quality care for children with dementia, but also for their families, and for childhood dementia to be a health policy priority. So, over the last 5 years, since we launched, we have begun to develop a really robust foundation of evidence. And what we wanted to do with this report was bring it together and start to summarise the problems that we're hearing consistently from families, from health professionals, from policymakers, from everybody involved in the care, support, research, treatment of these conditions, and also start to really show the pathway towards solutions. How can we improve the experience for our families? There are really three key areas to this report. And the first area is that there are no treatments and no cures for the majority of conditions that present with dementia in childhood. Currently, all of the children living with one of these diagnoses are doing so with a terminal diagnosis. They have a life-limiting condition. And there has been no notable improvement in survivorship in recent decades. And unfortunately, that for this group of disorders, we've seen other conditions jump ahead in leaps and bounds in terms of clinical development and treatments. And that graphic that you see there really illustrates this. Despite the similar number of deaths in childhood dementia and childhood cancer, today, or when this study was done, there were 43 times more clinical trials running for childhood cancer than childhood dementia. Now, that is not to take anything away from the amazing work that's been done by the researchers in the space of childhood cancer, but it does show us what's possible with focused investment and attention. Today, 84% of children who are diagnosed with a cancer will survive. Once upon a time, like childhood dementia, it was a death sentence. But there are other reasons as to why we're lagging behind in terms of the treatments and cures. Historically, there has been significant underfunding of the childhood dementia conditions. And so this is really the first thing that needs to change. We need more investment, targeted investment into research for the childhood dementia disorders. But it's also how we're doing that research. Up until quite recently, every single piece of research into a childhood dementia disorder has been done on a really fragmented and siloed basis. So looking at an individual condition at a time, rather than considering the common disease mechanisms or the symptoms that might be presenting, and looking for opportunities to collaborate across different disorders. So there's a huge opportunity to do things a little bit differently in this space, share information and really drive therapeutic development forward. Another problem is, and Nicole actually touched on this when she was introducing Toby, is that typically there is a delay of at least 2 years between the time that a child begins presenting with a childhood dementia symptoms and the diagnosis is delivered. And of course, this not only impacts the family who are desperately trying to find, answers to what's going on with their child, but it also hinders the development of therapies for that particular treatment. Often a child is diagnosed too late to be included into a clinical trial because their disease has progressed too far. And of course, that means that the clinical trial misses out on the opportunity to demonstrate that a particular therapy might actually work. So it's this really tragic catch-22 that we're caught up in. The other thing we've seen already is the gap in clinical trials. In the year that we did that review, we found that not a single new trial was started in Australia that year for children with dementia. And the ones that were running basically equated to about 2% of children living with dementia having the opportunity to access a clinical trial. And of course, remembering while there are no approved therapeutics or treatments, clinical trial really is the only opportunity that a child might have to access therapy in their lifetime. So this is something that is a really important indicator for us. And finally, we did find a small handful of conditions that had therapies that had been approved internationally, but they weren't available here. And we know that in Australia, there's an average of about 5 years of lag between the time a treatment is approved for use internationally until when it is available on a reimbursed basis here in Australia. So these are timelines. You think about those really short lifespans that we're facing for these children, just completely unacceptable. So that's the findings, and that's what we've been hearing over the last 5 years. Nicole, I really want to hand to you now and hear a little bit about your experience in seeking treatments or looking for therapies and getting involved in research, and how it's impacted you and your family and your ability to forward plan and all of those things. So I'm going to actually stop sharing my screen so that you pop up on our screen. And we'd love to hear from you.
Thanks. So post-diagnosis, we didn't receive any guidance at all. Everything I know about Cockayne syndrome has come from myself actively seeking connection with others, predominantly in the United Kingdom through a support organisation for Cockayne syndrome, and also through one of the world experts who is in America. Through those international connections is how I found out about current research occurring. I know of some research occurring in the United States at the moment. There may be some occurring in Europe, but I simply don't know. And I think that it's just not knowing what's out there and fearing that if there was something out there, coming across it too late for it to be of any benefit to Toby. Now, researching for a cure obviously is ongoing and it's quite lengthy. And so they're starting to, research into cures. It's not at a clinical trial stage yet, but it helps us understand the disease better and the mechanisms involved. But any research into treatments, therapies, what is best practice of care, that falls on me to try to access that information. And I'm interested as well just in research of how Cockayne syndrome works so that I can better understand my child and we can better design programs and treatments, therapies and whatnot, that will deliver the care that he needs, because it's neurodegenerative. So we don't want to set up unrealistic goals for him, but it would give me a much deeper understanding if I actually knew what was going on in him internally. But I feel that it all falls on me. So I haven't received any guidance about it in Australia at all.
So it all falls on you. A lot of the information that you've been able to find, you've been able to do from your own initiative, searching, internationally around the world. And a lot of that research that's happening, I mean, ultimately, a lot of stuff does focus on cures, doesn't it? And you know, of course, when we're first diagnosed, or when anybody hears about one of these conditions, the first thing that we go to is, well, we need a cure, which we absolutely do. But you've described, you know, wanting to understand your son better and how to kind of help manage his symptoms. There is a huge gap, isn't there, in terms of research and understanding what could I be doing to deliver the best quality of life for my kid. Is that something that you think, if you're thinking about sort of the prioritisation that we put around research, that we also need to focus on?
Absolutely. I know with Toby's specific syndrome, there's been research done through their London clinic to do with calorie intake and what that looks like for a child with his syndrome, and that's life-preserving. That's life-preserving stuff. They also use their own specific growth charts as well. So that's very important. I don't want him to be measured for height and weight based on the typical population, because Toby's not typical. He needs to be measured against his own cohort. So research, you know, occurs in terms of cures, yes, but also finding out about more basically about the conditions and how we best treat these people. And that results in preserving their life and their quality of life for as long as possible.
Yeah. And some of what you've described there, and I know you and I have spoken about this before, moves out of, you know, research and into healthcare. And that's actually one of the second area that our report really looked at. I'm just going to share the slides again, because the second area of issue was that the healthcare needs of children and their families are not being met. And this is being reported to us not just from families, but also from the healthcare professionals themselves. There's a few areas that we really articulated and I guess dove into in the report. The first one is there's limited expertise and information available about childhood dementia. We found families are, as you've described, desperately, you know, seeking care for their children from health professionals, and the health professionals are really often well-meaning, but struggling to provide the necessary supports within the current environment. They don't have access to knowledgeable peers. They're unlikely to have seen one of these conditions before, and they obviously have very limited resources. And so as a result, and I think you might have described it a couple of times when we've had conversations, Nicole, you become the expert, and you have to then work out, how do I manage my child's complex, ever-changing condition across this really fragmented system of care. And, you know, that's a huge burden for families to take on. And underpinning that limited expertise and information is a real chronic absence of data. It's almost impossible to identify children with dementia in our current health and disability and support systems. And so this invisibility means that even if there were clinical trials coming, finding the kids that could participate and be eligible would be really hard. And it's also not possible for us to drive evidence-based improvements in healthcare solutions without that data. So that's a big problem. The next area that has come out really consistently over the last 5 years is the lack of national consistency. There are no standards nationally. There's not a standard model of care for children with dementia. Where they live, the condition they have, the doctor who's leading their care, how well their family can advocate on their behalf are all factors that contribute to the level of care that a child can expect to receive. And that is just grossly inequitable. The next area that we hear over and over again from families is the lack of care coordination. And you know, there's a tremendous administrative burden around caring for one of these children. We talk to families who are navigating, you know, 10, 15 different specialties, plus allied health, plus NDIS, plus all of the other things that are coming along. And doing this in a way that isn't coordinated, that isn't set up for such complexities, and there is very little support in doing it. And last but certainly not least is the NDIS. And if you're joining this webinar from overseas, NDIS is our National Disability Insurance Scheme here in Australia. And it is absolutely essential for us to be able to provide the care that our kids need, but universally it's challenging to access. Families tell us that, very consistently, that the principle of the NDIS being one of capacity building and allowing a participant to be their very best version of themselves, and the experience that we have with childhood dementia, which is a declining, level of function and an increased level of disability, increased in intensity and complexity over time, are just completely counterintuitive. And that raises a huge amount of problems when we're looking at managing our kids through these various systems. So again, Nicole, I want to come to you. Can you talk us through some of the challenges that you've had in terms of accessing appropriate cares for Toby? And whatever you're happy to share with us.
Sure. So when I received Toby's diagnosis, which was via a telephone call, which I really don't think was the best way of delivering such terrible news to anybody. But I expected that I would go to healthcare professionals here and they would guide me or help me understand what's happening with my child. Because it's so rare and we're the only person in WA known with Cockayne syndrome, there's only a few more people, like less than 5 now, because a few have sadly passed away recently, and that's in Australia. Nobody knows anything really. And it's all up to me to find out more about my son and what's going on with him and how I best care for him. And I was told early on that you'll become the expert. And I'd say I'm not an expert, but I've had to try to become one. But that's a terrible thing to put on a parent as well. I'm a mother. I'm not a scientist, a researcher, or a medical professional. So I feel if I get this wrong, then what consequence is that going to have on my child's life and upon the rest of my family? It's a massive burden. Not burden, but
that's a really huge burden for you to carry, isn't it? Like, that's massive. And I've just realised I missed one of the really important bullet points on that last slide, and that was we don't provide adequate psychological support. And I think what you're describing, Nicole, really fits into that. You're taking on this dreadful burden to care for your child and do your best, but you're doing that without counselling, without psychological support. Certainly the families that we talk to, most of them are never referred to any kind of counselling. I'm just interested if that has been your experience too.
It has been my experience. I guess, except for a short stint through Perth's Rare Care Centre where I could access a genetic counsellor, and that was tremendously helpful. But the design of the Rare Care Centre is that we pass through that system. So it's not an ongoing service that I can access any sort of counselling. And I guess in terms of that having to be the expert, so I have gone overseas a couple of times with Toby to take him to a conference, and I've met a team of wonderful people from the London clinic, and I've got all of their contacts, and I pass that on to Toby's team here so that they're not the experts in his syndrome, but here's a list of people who are. So I feel that makes their job quite easy, really, to find out more. That's not always well received, though. Right. Some just don't. They're not interested. Some are, but
so you've actually gone to the other side of the world to find not only research but care for Toby and to drive that forward for him.
Yeah, knowledge, anything, just to find out anything, and also just to walk in a room and feel that we fit. And not feel so isolated. That obviously comes at a massive financial burden. I don't work because I'm the be-all and end-all care coordinator for Toby, plus I have 2 other children. So we have to fundraise, and it's hard, but this is my child's life. So what price do I put on it?
It's interesting that you say we don't fit. This is a line that we hear regularly from families who are managing the care for their kids with a childhood dementia disorder, regardless of which disorder it is. We just don't fit. And you also touched, Nicole, there on isolation, which actually leads beautifully into the third area of issue that was identified in this report, and that is the impact on Australian families. We partnered recently with University of New South Wales to undertake a really comprehensive national study to understand the psychosocial impacts on families. This hasn't been done before anywhere in the world. We wanted to really understand what were the pain points, what is life really like, and unsurprisingly, a lot of what was revealed in that study was really heartbreaking. Families face an overwhelming sense of social isolation and very limited understanding from the community about what they're going through and the challenges that they face. You've already described the economic hardship, which is significant for all of our families due to the care needs and the stresses that are associated with that, and the reduced ability to work, which is something that I know you've experienced yourself. The psychological distress, which we've talked about, affects the entire family unit, not just the child, but siblings and the more wider family unit. And of course, watching a child progressively lose skills and abilities creates a really unique, ongoing and unrelenting grief that you're carrying, along with all of the burden of trying to find research, trying to find care, trying to, keep Toby as well as you can. So, I think that this is a really huge area where we need to just be doing so much better for our families. I want to share with you some of the findings from the report that UNSW, or the study that UNSW did. The first one was around the levels of anxiety, and what they found was parents of children with dementia experience moderate to severe anxiety at rates 2 to 3 times higher than the general population did at the very height of the COVID-19 lockdowns. Now, that is incredible because everybody lived through that and can understand what that level of anxiety was like. But this, for families like yours, Nicole, can happen over years, sometimes decades. So, the implications and the impacts of living with that level of anxiety are just, huge. 92% of families who participated in the study reported that their work status had changed because of their child's condition. And in fact, 1 in 3 parents gave up their career entirely to care full-time for their children. So that, is driving not only the increase in social isolation, but the impact to the financial hardships, and all of those things really just accelerate from there, don't they? Nicole, you've shared a little bit with us already around some of those impacts and how your family has been affected. But can you talk us through, anything that you're comfortable in sharing, what it has been like for you having to manage all of that and with all of these psychosocial impacts thrown in on top?
It's all consuming and incredibly lonely, isolating, heartbreaking. You just feel like, the walls are crumbling all around you. And yeah, I used to be an early childhood teacher. I don't predict that I will ever be that again. Because of the nature of my child's disease, I can't be. Our lives are swallowed up by a healthcare system where I have no flexibility in the appointments, so I can't really commit to an employer. Plus the allied health industry, you name it. There's massive financial burden. And my other 2 children suffer as well because our lives literally revolve around Toby, and they adore him. But this is their life too, and it's hard enough trying to deal with this as a woman in her 40s, and I can't imagine being an 8-year-old or a 13-year-old like my other two kids and having to deal with this, because it's just such a heavy weight that I carry. How I do it, I don't know. I just do, until I guess the point where I drop. I don't know how I do it. I really don't.
Yeah, and it's frustrating, isn't it? Often people will say, "Well, you've got to look after yourself first. You know, put your own oxygen mask on first." But it doesn't seem like there's any opportunity to do that and take care of your own well-being. But yet, knowing that if you fall over, what does that mean for your entire family, and in terms of Toby's care? So it's a really, really difficult situation that we hear time and time again from families across the spectrum of the childhood dementia disorders. Yeah, and I'm interested, Nicole. You received the diagnosis of cocaine and have used that language. My kids have a condition called Sanfilippo syndrome. I use that language for a good 10 years. I've adapted my language in when I'm dealing with new people or trying to get someone to understand what my kids are going through. And I've found using the terminology of childhood dementia hugely helpful for me. I'm interested if that's also been your experience.
I've found it very, very positive to find somewhere that we fit, to know that there are people who are interested in children like my Toby and interested in families like mine. And I only came across the term childhood dementia and that cocaine syndrome fits under that umbrella quite by accident, when another family who are cocaine syndrome family posted something about Childhood Dementia Initiative. And that was the first time I'd ever heard the words childhood dementia, let alone knew that my son's syndrome was a part of that. But I feel like we have a place where we belong, and I'm now able to form connections with people who actually do understand this life, and we can work together to create real change here.
Yeah, and it is interesting the way I know, certainly in my journey, and it's not about me, but in my journey, where I have been stuck on something, often I've gotten a steer from a friend who has a child with a completely different condition, but is facing a lot of the same challenges. So we can learn a lot from each other as families as well. Yeah. So we've talked quite a lot about the problems. They're many. But one of the things that is becoming really clear to us as we move forward with the work that we're doing at Childhood Dementia Initiative is there are some obvious solutions that will meet the needs of not only the families who are impacted by childhood dementia, but the healthcare professionals who are working within the system, the policymakers who are making policy decisions, researchers who are working in this space. And so I want to spend a bit of time looking at the pathway to solutions and what we're really calling for and driving here at the Childhood Dementia Initiative. We're now at a point where we've gathered the evidence. I think we've reached a tipping point, if you like. We understand quite deeply the problems that are associated. We need to be turning our eye to solutions. And those solutions need to be nationally coordinated. We need a consistent model of care or a consistent approach to research, policy, care, and everything that's associated with childhood dementia. So families like yours, Nicole, aren't left with this inconsistent, inaccessible, inequitable system that we currently have. And we've seen already that there is this huge gap in dedicated services for childhood dementia. There are no dedicated services for childhood dementia nationally here in Australia. This is a huge challenge, but it actually is also quite a big opportunity for us. If you think back to the example we were looking at earlier and we compared childhood dementia and childhood cancer, one of the benefits that we have in childhood dementia is we've got a real green field. Nothing exists. One of the challenges that childhood cancer face is there are so many different siloed services that have popped up. Their challenge now is how to navigate them all. We're starting with a blank sheet of paper. And I think this represents for us a huge opportunity to really implement solutions in a coordinated way that is going to really allow great efficiency across all of the aspects of care and support for children with dementia. So we're working with the federal government to co-design solutions with health professionals and with families that is looking to develop a national centre of expertise. This national centre of expertise will allow us to implement standards and have a consistent model of care. It will allow expertise to be embedded across the health system. So it doesn't matter where you live, what your condition is, you will have a consistent experience when it comes to care, and your lead doctor will have access to all of the resources and information that they need. And it will also allow children with dementia to really access emerging therapies and clinical trials as they're coming through. But we also recognise that care and support extends beyond the health system, and there are many aspects that need to be improved and many gaps that need to be filled. Things like the NDIS, for example, or gaps in care networks and things that could support and empower families and reduce that isolation. So the second area that we're really looking at in terms of solutions is around an information and support hub, almost like a one-stop shop, if you like, for childhood dementia. And we're already beginning to develop some of the components of this. We'll shortly be launching an online platform for parents who will be able to come together and connect with each other. And we're also building a self-advocacy toolkit, which will empower and enable parents to really navigate the systems that are currently presented to them. So ultimately, a national coordinated approach would improve survivorship and symptom management for children with dementia and provide consistent, quality and equitable access to care, not only for the child, but for the entire family unit. And of course, you know, there are a bunch of stakeholders across the spectrum for which this will be hugely beneficial. You know, families, of course, are at the centre of it, children with dementia are at the centre of it, but you know, researchers will have their therapeutic pathways accelerated. They'll be more effective in how they do their research. Government will make better informed policy and meet the needs of the broader community. And of course, the health professionals will be enabled and empowered with the information and the resources and the connections that they need. So it's an exciting time, you know, for us as the childhood dementia community and as the Childhood Dementia Initiative driving this work. A lot still to be done, but I think huge opportunities. Nicole, really would like to hand over to you and just get your take on what this would mean to you as a mum caring for a child with childhood dementia. How would a solution like this help you in the work that you're doing with Toby?
I think given the genetic nature of childhood dementia diseases, we're not the first people and we are not going to be the last. There will be more kids diagnosed with these heartbreaking conditions. For me to know that there would be a national coordinated approach would help to lift that heavy burden that I carry 24/7. To know that there's communication between colleagues, between researchers, to have somewhere to go to ask questions from the real experts would just be amazing. I can't even describe how life-changing that would be. And there's only positive things that are going to come from it. And these will be life-preserving, you know, and hopefully ultimately life-saving outcomes that will happen. I'm very excited to hear that this is possible. And the time is now, because our children don't have the luxury of time. They are dying.
Yeah. I heard someone describe it as our clocks tick faster. And I think that's such a beautiful way of describing it. Our clocks tick faster. We need to see action. Yeah. So while we've been chatting, Nicole, we've had a few questions come through. So I'm going to jump across to them. There's one here for you initially. So answer as you like. Can you provide some examples of the challenges that you've faced with the NDIS and what changes would help?
I think For us, the biggest challenge has been going to plan review. Because Toby has a very complex syndrome, a form of childhood dementia that's regressive. Most people have never heard of his syndrome, and most people are quite unfamiliar with the term childhood dementia. So the evidence gathering takes a very, very long time. So recently we applied to go to change of circumstances. Now, by the time all the paperwork had been done, it was no sooner than his plan review. And the plan review indeed was running a few months behind, which then meant Toby's plan came a few months later. So yes, it was rolled over, but what I'm trying to illustrate here is the process is so long and we don't have time. And to try to anticipate what my child will need in the next 12 months, I simply don't know. It's regressive, and sometimes that regression occurs very, very quickly. Other times it might plateau or be, a gradual regression and then suddenly ramp up, but I can't tell you. So with going to change of circumstances, that process needs to be swift. It needs to be swift, and we need better understanding from the delegates that we're in contact with what these diseases look like, because we need a different model, I suppose, because it's not about achieving goals and a certain level of independence. For the more stable disabilities, sure, but these aren't stable disabilities that we're talking of here. So we don't tick any box, and nobody seems to have a correct frame of reference for us. And it's very, very difficult.
It's really interesting, Nicole, and I swear to God, everybody, this was not a planted question, and Nicole and I haven't actually talked about this, but we have recently, and it was since the release of the report that we looked at today, we have done a deep dive with families to understand what is the experience of the NDIS, and I think what you've described is absolutely typical of the experience of families, and really gets to the heart of what the problem is, and it is that disconnect between the principle of the NDIS being set up as an insurance scheme to build capacity and our children's declining positions and what has come from that. The key findings were exactly as you've described. There is no knowledge within the NDIA and the people who are working within the scheme of our conditions, and therefore no understanding of what's ahead of us. There's no ability to plan for what is coming or to even build in flexibility, because we know things are going to change. You can only look at what you've got in front of you. And then, of course, the review times are so long that families are reporting being left without essential services, equipment, home mods, etc., for months, sometimes years. There's absolutely change that needs to happen there, and we'll certainly be working with the NDIA to advocate for that. Another question, this one's a little bit trickier, and it points to the issue of safety, which I think is a really interesting topic, and we haven't talked too much about it here. With pressure for parents to be the experts, and if you don't get what you need here, you have to go overseas to see the experts. Are there concerns about safety for kids? I'll let you ponder that. I know certainly we hear quite a lot from families around being responsible for medicine management, for example, being responsible to make sure that, particular medicines don't interact, negatively, being responsible for making sure that an intervention that's delivered in a hospital setting isn't going to be detrimental to the health of your child. All of that falls to the family member, and we aren't experts, we aren't medically trained, so of course that comes with a huge amount of safety concern. But Nicole, I'm interested if that's something that plays on your mind as you care for Toby. Yeah,
100%. And this is the stuff that makes my heart sink or keeps me up at night, is thinking that if I get this wrong, there are serious contraindications with Toby with certain common antibiotics, anesthetics, sedations, administration of IV fluids. I have to play a very, very proactive role and get in touch with people who are overseas who know their stuff, and then really beg and plead the Children's Hospital for an appointment with the anaesthetist face-to-face before Toby goes in for any surgery, so that they really understand how to manage him.
Mm.
It's a frightening place to be as a parent, because I feel like his life is in my hands.
Mm.
And that, on top of everything else, is it's just wildly traumatizing to constantly live in that state of stress. I stopped something recently that was a procedure that was recommended for Toby, which was based on wrong information, based on using the wrong growth charts to measure his height and weight. If I hadn't have been onto that, then he would have gone in for surgery and had a peg insertion. You know, this is the stuff that I feel like I constantly have to gatekeep. And if I get it wrong, then he wears the consequences of that.
Mm. And that's the dreadful inequity, isn't it? That not only you have to carry that, but you know, Toby in a lot of ways is lucky that he's got you. You know, not everybody has the capability, the tenacity, the resources, you know, to do all of those things. So the inequity that we hear is just so overwhelming. Another question. Will the Information and Support Hub have resources applicable to all childhood dementias? That's a great question. We're obviously still designing what this solution will look like ongoing, but the work that we do is always focused on what is the common experience for children who have one of these dementia conditions, and how can we benefit from the collective. Where there are existing materials available, for example, I know in the Sanfilippo space there is a clinical guideline that exists. We would like to make sure that all of that information is accessible when families need it. So whilst we won't necessarily be developing ourselves individual resources on the specifics around a particular condition, where they do exist, we will certainly be making sure that they are available to families as needed. Another question, I can hear how beneficial speaking with other families has been. Are there plans for CDI to support more of this? Absolutely, connection amongst families is such a critical thing. And Nicole, you described, I think it was the long table in Perth that you attended, and you found your tribe that day. Would really love to kind of hear about, you know, some of what you got out of that. But it is certainly the ability to bring families together and connect is absolutely critical. It reduces social isolation. You know, there are a whole range of benefits as to why. We have the online digital community, which we'll be launching very soon, which will be the first step toward that. And we are also looking at a program to engage peers, and how do we best connect people together with their peers in order for them to move through this journey together. Nicole, I don't know if you have anything you want to add to that.
Yeah, we had to go overseas, I suppose, to find where we fit, and we were so acknowledged and loved and supported. It was very hard to come home. Then when I participated in the long table event, different syndromes, but same, you know, same but different, but very, very same. Sitting there amongst those people was the first time that I really felt seen and heard and acknowledged in my own country. It was a life-changing moment for me to feel like I've found where we belong here in Australia. So I cannot wait for that development of community here in my own country. I know for myself, I desperately, desperately need it. And I'm sure others do as well. And I'm so thrilled that it's going to happen.
Yeah, great. Another question, amazing to hear CDI's platform for parents and advocacy toolkit. Does CDI see a role for your organisation in the international space, e.g. linking research and trials, clinical standards, etc. in other countries? Yes, so we always say childhood dementia is a global problem that needs global solutions. We are doing a lot of work here in Australia with the idea of it being a proof of concept that can then be scaled and implemented internationally. We have begun working with some international partners. We're running a pilot with Alzheimer's Scotland to deliver services to children with dementia in their region, and we're talking to a number of other countries who are also interested in the approach that has been taken here in Australia and the outcomes that have been achieved, and how we might move together to helping expand the work that we're doing here. In terms of research and clinical trials specifically, I think global engagement is absolutely critical. There are great researchers here, but we know that a lot of the work that has been happening overseas. And so we need to make sure that there is that ability to connect, to understand what's coming. And it's a significant component of the Centre of Expertise that is being designed this year is around enabling access to clinical trials and enabling access to emerging therapeutics. So we haven't got all of the detail around that yet, but we're expecting it will be things like looking at the horizon scanning, identifying early stage therapeutics that are coming through the pipeline, stimulating research, to move those things forward, and getting our kids here in Australia access to those, whether it's, travelling to a clinical trial or bringing clinical trials here. So I think that the connection with researchers in Australia and international is a huge area for us. We are also looking at, we're seeking funding at the moment. If anybody out there would like to contact us, please do, to develop a blueprint for research globally, so that if research is undertaken, it's done, again, in a coordinated way. What we don't want is to just throw money at an isolated research project when there is a more efficient way of doing that will impact and enable a number of these conditions, or fits within the priorities that have been set by the families and the researchers who are involved. I hope that answered that question. We're running a little short on time, but there's one more question here. 92% of parents of children with childhood dementia have their work impacted. What options are available to families to manage the complexities of and the time and effort involved of coordinating for their child with childhood dementia? What might a solution look like? Oh, that's a big one. I'm not aware of options available that specifically help families manage the complexities. I know caring in general is an area that is being looked at, but I think like a lot of these things, it's always, and then what? Because we're like here, but because of the complexities of childhood dementia, the needs of our carers are bigger than the average carer. So, Nicole, I'd really love your insight if you have any thoughts around what a solution might look like that would enable you to potentially, keep working or keep, your social and community engagement whilst juggling this really complex care for your child.
There's probably a few things which I guess could help. One would be the NDIS providing support work hours. That has been very, very important in my family. And also as well, a coordinated appointment system. So there's no flexibility in that. So I receive a letter in the letterbox, the day, the time, and it's usually someone different depending on which clinic it is we're visiting at the hospital. Not having any flexibility over an appointment system makes it very difficult to commit to an employer, because if I say I'm going to work a couple of days a week, and I did try this a couple of years ago, to work 2 days a week, and literally every other week I was saying I can't work that day. And I felt dreadful doing that to an employer. This was at a school, so it's not like I can let a bunch of students down and other staff members, and it just wasn't doable. So there has to be, I think, a coordinated team approach for children with complex illnesses like childhood dementias. And it does work in other parts of the world in terms of rare disease clinics. So you've got your Guy's and St Thomas's Cockayne Syndrome Clinic in London. There are many more as well, rare disease clinics, where it's a coordinated team approach and your appointments are taken care of by the same medical professionals on the same day, and then information is shared back in the hometowns of where those patients are from.
Mm.
For me, that would be just completely freeing, where I'd feel like I'm not just living in this prison where I'm just tied to the medical system. I have no life outside of it, none.
Mm. A bit of a nod to one of our team, Gail Hilton. She's undertaking a Churchill Fellowship this year, where she's going to travel to a number of different countries and see how things are done around models of care and delivery of services. And we're really looking forward to what she finds and what learnings she brings back that we might be able to implement here. I think it's going to be a hugely valuable thing. Not expecting to find the magical answer, but I do know that there'll be nuggets like what you've mentioned around the clinic in London that she'll uncover. So perhaps we'll have another webinar on that when she gets back with her findings. So, well, Nicole, thank you so much. Is there anything else you want to add that we haven't covered before we wrap up and I share some final information with the attendees?
I guess I'd like to add thank you to everybody who's here and listening or watching this, because we need action. We don't have the luxury of time. Our children are dying, and there are more children being born with childhood dementia conditions, and at the moment they're going to die before their time as well. So the time is now, and Childhood Dementia Initiative has certainly put all the information out there on the table, and now it's time to come together and actually work towards the solutions.
Thanks, Nicole, and thank you for coming today and for sharing your experience. I know it is a huge thing to ask of a family to be so open and vulnerable, but thank you for sharing. It really does help us all to understand the challenges and the solutions that we need to implement. Okay, so I'm just going to pop up a QR code. We would love feedback on the session today. So if you're able to click on a QR code, that link, and do an evaluation, that would be wonderful. If you'd like to download the report that we've been talking about today, there's a URL that I've put there on the slide. It's also available on our website. And we'd love to hear from anybody who has feedback, and love for you to connect in with the Childhood Dementia Initiative. Sign up to our newsletter and follow us on the social media. Just stay across what's happening. There's a lot of progress that we're making, and that will continue over certainly the next couple of years. So thank you everybody for your time today. Really appreciate spending this hour with you, and thank you again, Nicole.